Good afternoon. My name is Kim Magoon. I work for a public consulting group in Maine's office, and I specialize in child welfare and substance use prevention evaluation. So thank you for joining us today for evaluation for substance use prevention professionals and conducting a program evaluation. So while I've worked in a lot of different various areas in Maine and West Virginia and Nevada and Arkansas and Colorado, I'm currently the evaluation lead for the Prevention Technology Transfer Center of New England, and I'm joined today by Megan Hawks. So I'll let her introduce herself.
Hi, my name is Megan Hawks. I am an evaluation supervisor at Public Consulting Group. I have almost a decade of working in public health on various projects related to substance use, behavioral health, mental health, population health, prevention, treatment, and recovery, as well as data projects promoting cross-sector data sharing, analysis, and dashboard creation for state and local agencies.
So as part of the New England Prevention Technology Transfer Center, this is a Substance Abuse and Mental Health Services Administration cooperative agreement, and there is our cooperative agreement number. So this is our acknowledgement. And then also, we believe in the use of affirming language because affirming language inspires hope and language matters, and words have power. Today's session is actually the third session in a four-part series for evaluation for substance use prevention professionals. So we held the first session, which was the introduction to evaluation, in December. The second part focused on design of an evaluation, and that was in February. And then today we're going to talk about conducting the evaluation. So in June, we'll conclude this series with using evaluation to make data-driven decisions, focused on telling your story and using evaluation results and disseminating them to a variety of stakeholders. And so with this foundation, we're really hoping that participants will be empowered to make decisions about how to conduct and implement their evaluations for their substance use prevention programs. So let's spend a couple minutes and we'll look at the agenda. First, we're going to talk about our previous session. So if you attend the first couple of sessions, you know that we gave people some homework. So we're going to check in on that. Then we'll review objectives for today's sessions. And then finally, we'll have a short group activity at the end where folks can apply some skills and return at the end with some discussion about where we're going from here. So for the webinar in February, we talked about different types of evaluation and how to write evaluation questions and how to choose a sample and how to really start putting together that evaluation plan. But following that webinar, we asked participants to complete some homework and utilize the worksheet to think about 3 action steps that they could take to further their evaluation design. So we suggested that if you hadn't started thinking about your theory of change, that you could start there. And second, if you didn't get a chance to finish that activity in February, then you could do that. So drafting a purpose, coming up with what evaluation type is appropriate, drafting a couple of questions, and then really using that theory of change so that you can work on defining your target population, outlining a plan to create a sample. And then finally, really starting to dive into that data collection plan. So the bottom part of this form was also pre-populated so that once people started making some headway, they could really take some notes on what was working, where they needed help. And this was a great place for people to make notes about where the New England PTTC could really step in and help out. So I want to just take a couple of moments to circle back with folks who participated in these first couple of sessions, who may use this worksheet to really think about their own evaluation. And maybe you can go ahead and put something in the chat. Did you have any surprises? Were there resources or information that you discovered that you needed or tripped you up? Or that you couldn't find? And is this a place where the PTTC could really help out? So we'll give just a couple of seconds for people to put some responses into the chat here. So as folks are entering that information, we're going to keep this form in mind and return to it at the end of the session. because we're going to have some more homework for you for next time. But first, let's talk about your evaluation. So during this session, we hope that participants are going to learn the difference and importance of choosing the right kind of tools, identifying procedures for collecting and storing information securely, identifying tools for data analysis, and creating a sustainable evaluation plan for that continuous quality improvement. And in the first part of this series, we use this example of a fictitious evidence-based program called Smarter Start to relate our concepts. So we'll keep coming back to this today. So this is our theory of change to drive our evaluation design. And we'll go ahead and look at this example just to recap for folks and for some new folks in the group. So in this example, our theory of change follows that if-then methodology. So first, I have my assumptions. I observe that marijuana use among high school youth has steadily increased over the last decade in Armstrong County. I could empirically see this because I could use data like the National Survey on Drug Use and Health for larger populations, and I could see, or I could look at data for marijuana-related school suspensions in the district, or maybe some community-level survey data. And I think this is really because there's a lack of knowledge regarding risk of marijuana use and this decreased perception of harm. Because these are also two variables that I could really empirically use data to see. So I could see change in legislation for the state where adult use has become legalized. I could see change in perception of harm from these bigger data sets about parents and youth. And so we're really going to do this activity. We're going to do the Smarter Start program in all three of these school districts in Armstrong County. And the outcome and long-term impact that I hope to see is that there's going to be, that the rate of marijuana use in the high school youth is going to decrease by 20% by 2025. So based on our session in February, we established this evaluation plan. The purpose of our evaluation is really to determine if Smarter Start has the impact on students' knowledge, their perception of harm and consumption of marijuana in Armstrong County. We're going to do this by using a quasi-experimental format with a process and outcome measures. And then here's some examples of evaluation questions for process and outcome measures. For example, I might want to know how closely was the program followed in terms of program fidelity for parents, for youth, for teachers. Was it offered to everybody that it was applicable for? Was it offered to all of the youth, all of the parents, all the teachers? And did they attend? And for my outcome evaluation, I might want to know to what extent did the program actually increase knowledge of marijuana use risk? And how did that project align with other prevention campaigns that the school has going on? And to what extent did it impact the marijuana-related school suspensions or restorative justice actions that the schools are taking? So in the first couple of sessions, we introduced a couple of different kind of evaluation cycles, and this is what I really like. It's a CDC framework approach. And we started off describing our program and then focusing on that evaluation design. And today we're going to move on to gathering that credible evidence and talking about how we're going to justify our conclusions. So to do this, we need to collect some information, right? So in February, again, we talked about how the choice of your data collection design has implications for what's actually going to count as evidence, how that evidence is going to be gathered, and what kind of claims you can make about the data and the larger population. So we also talked about the advantages of using mixed methods. So that's collecting both quantitative and qualitative information, and both definitely have merit and purpose. But today we're going to delve a little deeper into these types of data collection. So first, there are different types of quantitative and qualitative data. For example, quantitative data might include epidemiological data. And this kind of stuff usually answers questions about disease, injury, substance use, consumption, other environmental issues. This type of data is typically used to look at patterns and social norms regarding public health. So examples of this kind of data might be the CDC's National Adult or Youth Tobacco Survey. That's epidemiological data. Administrative data are usually collected by governments or organizations regarding information for registration, transactions, record keeping. So Medicaid billing and claims would be an example of an administrative data set. Surveys and questionnaires you'll see are on both lists. And they can really provide both quantitative and qualitative data depending on the type of questions you're asking. So these are done in paper and pencil, they're online, they're over the phone. And you ask a set of predetermined questions. So surveys really allow you to gather feedback from a larger group of people, but may not have as much nuanced information. So you can't ask any clarifying questions after the fact because the survey is already done, it's complete, and you're not going back. However, some open-ended questions within the survey might give your respondents a chance to expound upon a quantitative choice that they've already made. So for example, I might ask how many times a month a youth uses marijuana, and then my open-ended follow-up question would be, might be about in what context do you use? Is it only at parties? Is it only with friends? It is only on XYZ occasion? And what does that youth context look like? And so that might help me better understand and describe what kind of circumstances youth are using. For qualitative data, we think about things like environmental scans. These are observations of various aspects of your community. An environmental scan can be difficult to conduct because in a way that represents your whole community. Particularly if your community covers a wide geographic region, because it's not likely that you have the resources to conduct a large-scale scan. And you have to focus your efforts to target an area or key informants. So in this example, you might get some data from the school board about school incidents or discipline reports related to drug use. That could be part of your environmental scan. Interviews, these are structured or unstructured one-on-one directed conversations with individuals or leaders in the community. And these are sometimes called key informant interviews. They mean the same thing. Their perspectives can really provide meaningful assessment of substance use and consequences observed within areas of responsibility. So they can really add to your knowledge of those intervening and contributing factors of understanding the when, the why, the where of substance use and the related consequences. Focus groups can also be important qualitative data collection method. So these are structured interviews with smaller groups of individuals using standardized questions and following follow-up format. So these are typically led by a facilitator who presents a small number of targeted questions and really helps to facilitate that conversation with a group of maybe 5 to 8 people. And participants can share their ideas and observations and really clarify your issues. And sometimes this is nice because it allows you to delve more deeply into the topic. And if, sometimes folks will feel a little more comfortable in a group setting. And so this can help really lead you to topics or points of perspective that you hadn't considered before. But recruiting for these groups can be challenging and it can be time consuming. And then lastly, we want to talk about meetings and meeting notes. And this is what we call documentation review. And this is another really important part of qualitative data collection. So documentation review is really the review of documented conversations, lectures, presentations, and these are really used as source material. So for example, I might look at school board meeting minutes to give me a sense of what topics are important to the school board and what the general consensus of the board is on those topics and how they feel about them. However, the best way to answer the question is to ask it, right? And quantitative and qualitative data can help you answer a different types of questions. So whereas quantitative data usually answers how many How much? How often? What is it? Where does it occur? Qualitative really answers the how and the why. So we use different tools to look at these types of data as well. So for quantitative data, we might look at, might use Excel or SPSS or R, Python, whereas qualitative we might also use Excel, but we might use NVivo or MaxQDA or some other software to look at that. And each of these has their own potential drawbacks as well. So quantitative, again, could be pretty easy to collect and could be faster. But analysis of that could be a little more complex depending on what you want to know. And then qualitative data usually takes more time and usually requires more staff training in how to clean and look at that data as well. So, but it's also giving you more context and more description than just straight numbers would give you. So they're both important, but they both have some pros and cons. Here's another way to think about pros and cons for quantitative and qualitative data collection. So quantitative is also more observational in number. It's generally just counts of things, whereas qualitative is more descriptive. Quantitative offers objective, distinct numbers, where qualitative provides that insight about processes and perceptions. Quantitative usually takes less time to collect and analyze, whereas qualitative usually takes longer. And the quantitative numbers could be more clear because if you have a number, it's that number, but doesn't tell you what that number means. Whereas the qualitative does. The qualitative offers that context. And so sometimes the results of the qualitative information aren't as clear. They require more interpretation and more triangulation of findings, which we'll get into here in a little bit. So sometimes going back to your plan can really help determine that best type of data collection strategy. Again, here's the example that we've been using and of how it might all come together for our Smarter Start program. So on the left, you have the strategies or the goals of your program. Next, you have the evaluation questions of what you're going to ask. And then I have my indicators list. That's how I'm going to answer each of those questions and what I have to know. And then I went through with each of the indicators and thought about how I could actually get that information. And that's how I came up with my data source column. So for this program, I might want to know how closely my program followed implementation fidelity factors for youth, parents, and teachers. In other words, was the program delivered the way it was intended by the program designers? That's a pretty common request for a lot of program evaluation, right? You want to know, did you implement it the right way? Especially with evidence-based programs. So if that program was supposed to be broken into 4 90-minute assemblies that covered these specific topics, did that happen? And so for this example, I can find that out by looking at some training records. So when were the assemblies done? Are the trainings given? Who was there? How long did it last? What did the training actually cover? And how long did it take? And so that would be a great example of a quantitative data collection methodology and how I would get there. I might also want to know how this program aligned to other prevention campaigns in the school to see if there's different tactics that might have been tried before, or how to get a sense of how supportive that school is of these kind of efforts. And so for that question, I could look at the school district handbook, and that might give me some clues. But it would probably be actually better to talk to some people, right? I want to talk to the school board about this. So this might be a great example of where qualitative data collection would work best. So in this circumstance, school boards might be pretty big, maybe a dozen or more people. And so people on the school board might also have very different opinions about what the priorities of the board might be or should be. And so I might want to interview people one-on-one instead of putting them all in a group together to get people to feel more comfortable answering my questions. And so everyone gets a chance. So that might be how I develop my interview protocol for the school board members. And then once we know what information we need to collect, we need to design a tool to request, we need to design the tool or request that information, right? So for training participant survey, I might ask questions like true or false. The concentration of THC in marijuana has tripled in the last few decades. And I could do that with a tool like SurveyMonkey or Qualtrics or Microsoft Forms. And I could send out my survey that way. Similarly, for parent interviews, I might write a phone interview protocol and ask questions like, to what degree do you think your child is at risk of harm for using marijuana once or twice a week? And that might be a question I can ask in an interview protocol just over the phone. However, for high school students or high school youth, it might be more effective to do a survey or to collect some school statistics. So if I want to collect school statistics, I probably need to submit a data request to the school to get that information. And then I'll be able to use that data to answer my questions about have you ever used marijuana at least once in the past 30 days? And how many marijuana related school suspensions did the district have before the program started? So data requests are pretty straightforward. Sometimes organizations will have a standardized form and sometimes you just have to email them, but they all contain kind of the same information. So what data is requested, specifically what elements or variables do you want? Why do you need the data? And what is it going to be used for? In what format do you want the data? And who's requesting this data? Who's requesting and who should receive this data? So in this request, we can see that we introduce ourselves a little bit about who PCG is and why we're asking for this data. The project purpose, because we want to know the impact of this program on students' knowledge, perception of harm, and consumption. And then here's my information because I'm the requester and I would like to receive the data. And then as part of this program evaluation, here's what we're looking for. Here's the specific elements of data that I want from the school. And I'd like to receive it in a flat file, which means just something like Excel or CSV it's not already in a table, it's not already processed. I just want the raw data. I just want counts and numbers so I can see it and interpret it for this particular evaluation. So in this request, I'm asking for total number of students by grade, academic standing by student, if possible, list of the school board members with some contact information so I can reach out to them, list of school disciplinary actions, so I can kind of get some counts on what that looks like. And then copies of their drug policies so I can see where the school is already at and what other initiatives they have going on. So in February, we also talked about preparations for this part, about collecting and storing your data and really having your project reviewed by the International or Institutional Review Board, the IRB, and making sure that your subjects are properly informed with informed consent. And today we're really going to take steps one step further. And so we're going to talk about secure collection and storing of data. This is a quote from the AEA, the American Evaluation Association. It says, the information used in the evaluation should be kept secure and should be carefully processed and maintained so as to ensure that the data maintained and analyzed are the same as the data collected. Because we're not trying to manipulate data between the time that we collect it and how we report it. We want there to be a certain level of integrity and security in that data. So the principles are outlined nicely by Princeton Research, Integrity, and Assurance, but these also really align with the American Evaluation's guiding principles to reduce unnecessary risks of harm to groups of individuals associated with the evaluation and really honor those promises of confidentiality. So first and foremost, you only collect data that you need. Data collection takes time, it takes money, it takes resources and staffing. So don't collect more data if you aren't going to use it. Second, we want to limit access to data. So the only people who are actually helping you to collect or analyze the data should have access to it. There's no need for other people to be seeing that. Sometimes it's necessary to have data sharing agreements with an organization. And this is really more of like a formal legal contract that really specifies the data that you are to receive, how it's going to be used, stored, and shared. So this might be important if you're getting data from, we do program evaluations a lot of the time about evidence-based programs. And so sometimes we have data sharing agreements specifically with those agencies so that it's a legally binding contract that confirms that we're not sharing that data with anybody. We're not selling anything to anybody, and we're not using that information for anything except for this evaluation. De-identified data is almost always enough for program evaluation and reporting, and the kind of reporting that we're talking about. So there really should be few and far between reasons why you would ever need to go back to a respondent and collect names and addresses or any contact information for these folks. But it's not out of the realm of possibility that you might ask someone in a survey to see if they want to opt into a mailing list at the same time. That's done pretty often, right? So, hey, you've taken our webinar today, and tell us how we did. Oh, by the way, do you want to receive information about future webinars? Happens all the time, and there's ways to do that. It is secure and completely separate from the data collected. So de-identified data is almost always enough, but there are ways to collect identifying information that is kept separate and secured from the analysis data. There's also 4 primary methods for secure data storage. So we really want to use secure methods to transfer files. So many companies have and organizations have auto encryption for their email servers, but sometimes this really isn't possible. Sometimes you have huge data files. You really can't do this. And so we could utilize a safe file transfer protocol site or an FTP that requires a login to transfer data. This is kind of a more sophisticated Dropbox where each party is using a password and a login to log into this secured folder, upload information, and then download information. We also want to use password protected documents or systems that of lock and key if it has to be on paper. And again, these really serve to limit the access to people that to this data so that only the people who need access have access. And we want to keep data access lists updated so that when people leave the project or leave the agency, that they no longer have access to that information. So this happens again all the time in organizations everywhere who are collecting this information. Somebody switches departments or leaves the agency, you deactivate their login because they don't need that data anymore. There's no reason for them to have access to that. And then lastly, we want to use effective methods for data destruction. So some projects or grants require that you keep data for a certain length of time. Totally acceptable, totally normal. But sometimes you have to destroy the data because of a promise of confidentiality you've made to your participants. And a good example of this might be for focus groups. So in a focus group, there's going to be a ton of people talking, and I might not be able to write fast enough to keep track of notes for this. So I might ask a focus group if I can record the conversation. But I can record the conversation only insofar that I'm going to use that recording to make a hard copy transcript, and then I will destroy the recording. So in that transcript, people won't be identified by Joey said this and Sammy said that. It'll be speaker 1, speaker 2, and it'll be completely identified, but I'll have a list of what everybody said. That's important for data analysis and data collection, but it's not necessarily, but the recording itself isn't important. So if part of what I put in my informed consent is that I'm going to destroy that recording after I make that transcript, I better effectively destroy that recording after I make that transcript, because that's a promise of confidentiality and anonymity that I've made to my people. But next, we're going to talk about some data analysis.
Great, thank you, Kim. So once you've collected all of your data, you're going to need to analyze it. And so we're continuing to move through the evaluation cycle, and we'll examine the data and then justify the conclusions. So much like choosing how to collect your data, the approach you take for analysis really depends on what kind of data you collected, what you want to know, the cost, time, expertise, and staff availability to conduct the analysis. Thus far, we've collected both quantitative and qualitative data from administrative school data, surveys, and interviews. So for quantitative analysis, we have descriptive statistics, regression, and correlation analysis. For descriptive statistics, you can do frequencies, percents, or averages. And so for our study, we determined that 85% of students had an increase in perception of harm. Some more advanced analysis are correlation and regression, which are statistical analysis measurements used to find connections between two variables, measure the connections, and then make predictions. So for example, one might think seeing someone driving an expensive car and automatically assume that the driver must be financially successful. And so as you're seeing one variable, a fancy car, and then seeing if there is a direct relationship to another variable, which is being wealthy. So regression analysis is a set of statistical methods used for the estimation of the relationship between a dependent variable and one or more independent variables. It can be utilized to assess the strength of the relationship between the variables or for modeling the future relationship and predicting. So how does one thing cause or affect another? So for example, regression analysis was performed on the survey and will allow PCG to understand which facets of the marijuana education program had the biggest impact in reducing substance use related to marijuana. And so as an example, regression analysis could find that education related to the harms of marijuana and then reinforcement of the education with parents were key program components that were associated with lowering substance use. And then there's correlation analysis, which is more of a fancy term for the mutual relationship or connection between two or more things. This determines a co-relationship or an association between the two variables. So for example, as part of the school survey, questions included levels of use of marijuana, intentions to use marijuana, and problems resulting from use. Also, there were questions related to peer pressure and self-esteem. So as an example, correlation analysis could find that high levels of marijuana use were correlated with peer pressure to use marijuana. So the difference between these two statistical measurements is that correlation measures the degree of a relationship between the two variables, whereas regression is how one variable affects another. So use correlation for a quick and simple summary of the direction and strength of the relationship between two or more numeric values, and use regression when you're looking to predict, optimize, or explain a number in response between the variables. So how does one thing influence another? And then there's qualitative analysis. So that's more of looking at the text. So content analysis is a research tool used to determine the presence of words, themes, or concepts within some given qualitative data set, which is the text. So using content analysis, researchers can quantify and analyze the presence, meanings, and relationships of certain words, themes, and concepts. So key themes that emerged were marijuana was way more accessible than when the parents, were growing up, and they feel this added pressure to potential use. Another theme that emerged was that many parents did not think their children were using marijuana. We often see a disconnect there. Narrative analysis refers to a method for interpreting text journals, conversations, interviews, and focus groups. People really tell stories to organize and make sense of their lives, and their stories are accounts of, and their stories can be used as accounts for functional and purposeful meaning. So this method really helps to build context around the situation. So for example, a family's perception of harm may be low because the mom uses marijuana for her cancer as a medicine, and it's not contextualized to be a big deal in their family. Another qualitative approach is grounded theory. This one's a bit more complicated. So this is an approach for developing a theory about the subject that is grounded in data, which is systematically gathered and analyzed. So you produce transcripts of interviews and read through the small sample of text. Then you'd like to identify potential analytical categories or potential themes that arise. Then, as the categories emerge, you can pull data from those categories and compare them. And then you want to consider how the categories are linked together, and then use the relationships among the categories to build a theoretical model. And then you want to constantly check that model against the data. So especially against negative cases that could potentially go against your theory. And then you want to present the results of the analysis using quotes from the interviews that illuminate this theory that you've developed. So let's put that in context. There are a few qualitative questions on the survey for students to describe their experiences using marijuana. So this was done to better understand the meaning that was placed on these experiences. So 4 predominant categories emerged when we did the analysis: influencers, advertising exposure, deciding factors, and knowledge. And so within the major categories, there were also additional themes, such as within the influencers category, there were peers, family, and individuals. And then within the knowledge category, there was known knowledge and then needed knowledge. And so this analysis was supported by quotes. So marijuana is everywhere. Even people you may not think are using it are using it. And this is contradicted by other quotes related to knowledge that was not known. What does it do? I don't really understand how it affects my body. So regardless of what methods are chosen, evaluation procedures of your analysis should be meticulously documented so that the results are transparent and can be reproducible. And so the approach you take in choosing the software to process your data really depends on a few factors. So what type of data are you analyzing? Is it qualitative or quantitative? What is your accessibility to this software? Some softwares can be very expensive. Do you have the software already? Maybe you really need to conduct this analysis in a short time frame because you just got the data and your report is due in a couple weeks. So you may not have the ability to learn a new software or even get a new software. So you might have to use Excel. The ease of use of the software. Does staff have experience in using the software? The types of analysis you're going to do. So if you're going to do something more basic, such as the frequency analysis, you can use Excel or SPSS, whereas if you're going to do some of that regression modeling we talked about, you might want something more powerful. And then the type of reporting that you're going to be producing. So for example, I want to know some counts of the things. So the number of sessions offered, the number of youth by grade who attended, and the number of parents and teachers who attended my sessions as well. So I'm also going to want to know something about the change in perception of knowledge related to marijuana use, the perception of harm change. And so this is a variable that will need to be calculated comparing the pre and post tests in creating a new variable. So I also collected documents from the school to determine if there were changes in the drug school policies. So I'm going to put these things together. So with the data sources I'm using, along with the kind of questions that I'm asking from the evaluation plan, as well as the amount of data that I've collected so far, also keeping in mind that I will probably be looking at this data across the school district, I want some software that's a little more sophisticated than Excel, but I may not need something that is super powerful because looking at my questions, I don't think I really need to do a regression analysis. So I think I'm going to use SPSS and NVivo to look at my data. So one of the strongest analysis strategies that you can use is triangulation of findings, pictured here. So triangulation refers to the practice of using multiple data sources or multiple approaches to analyzing data to enhance the credibility of the findings. This is also a way to use qualitative data to confirm and give context to some of the quantitative information that you have been using. It also helps you not rely on just one particular indicator or data source to determine the effects of your program. So for example, I might want to look at school records across the time period for when I implemented my program to see if there's a decrease in marijuana-related suspensions. In a perfect world, I might also ask students and parents before and after my program to rate their perception of harm for using marijuana in the survey. And then I also might see that the perception of harm and knowledge about risks of marijuana use has increased over time as a direct relation to my program. And then when I look at some of the interview data with youth and parents, I see a theme where students and parents were saying the program really made me think twice about using marijuana, or now I know how to talk to my child about their drug use. So in this circumstance, I can triangulate these data sources and findings to effectively show and support that youth and parents are becoming better educated about the risks, which seem to be influencing their perception of harm for using marijuana, which in turn is influencing the youth behavior, which is achieving the outcome that I was hoping for. So we all know that things never work perfectly in practice. So what happens if you look at the findings and there's going to be mixed results? For example, the interviews with parents and students and the student survey corroborate a positive change in knowledge and perception of harm, but there's no change in the marijuana-related violations. So it looks like the program is working well to some extent, but I'm not getting the behavior impact that I desired. So first I'll want to look at the larger high school survey, like the MIAS, to see if there's an overall change in marijuana use across the districts. Because the survey will show me the picture of use, not just for the youth that participated in the program, but for the whole district. So maybe it's just that youth who took the smaller survey about the training didn't have any issues with marijuana to start. So alternatively, this kind of finding might mean that my program isn't getting to the right people. So maybe there's something about the youth and the parents who most need to hear this information that aren't able or willing to attend the programming for some reason. So I might need to check my survey demographics and the training records for attendance to see if I'm getting the response rate that is proportionate to the population that I see in the survey using marijuana, or if I need to do some targeted outreach to certain groups to make sure that they're getting the information and the messages. In another situation and looking closer at the student demographics, I may also see that it's only boys who are getting violations. So maybe there's greater work that needs to be done working with the schools and the school policy. So my conclusion now might be that youth and parents are still becoming better educated, at least those that were attending the program, but there might be more context to say that the program isn't having the intended behavioral effects related to the violations because of XYZ reason that I stated. So this is also a good time to take a pause and think about the results of the analysis and how you want to present them to your stakeholders. We'll go into this more in depth at our next session. So there may be an instance where you need to complete a one-time evaluation for a program or project, but more often than not, SAMHSA and other funders want you to use the Strategic Prevention Framework model, which really encourages the use of continuous quality improvement and conducting evaluation on an ongoing basis. So we want to be thinking about how to develop this evaluation plan and cycle so that it's sustainable and can be repeated with some regularity. So here are the 5 rules for making a sustainable evaluation plan and implementing a sustainable evaluation. Don't make it overly complicated. Try to keep things simple. Make sure that you look for data in places where it is already being collected. Many states have state epidemiological outcomes work group, such as in Maine. They have a really great dashboard. And you can find a lot of different indicators there. So you're not going to need to go and make some of those data requests for that epidemiological data because you already have it. And there's often tools and resources on those pages as well that already break it down for you. You also don't want to reinvent the wheel. So talk to your fellow coalition or substance use prevention organizations, as they likely will have resources. And finally, if you do need to create a tool, make sure you create them in platforms that can be recreated or passed off, and set up the data collection in a way in which you can use a tool for many years to come. We've had situations where you make a form or survey tool in Microsoft Forms and it happens to be attached to your account, and then that person may leave the organization and so goes your survey. So make sure that you cover your bases with getting that information before they leave. And also think about the time, staff, and money you have available to invest in your evaluation. And also think about how your evaluation is going to be used. And you might want to talk to a number of stakeholders about that right when you're doing your evaluation planning, like we've talked about in the beginning with engaging stakeholders. Is the evaluation going to be used to make decisions, or will you want to compare results over time? And that might play differently into how you're collecting your data. And then think about how you can integrate evaluation into existing workflows and processes. At the end of the day, we don't want to be adding another thing to people's plates. Sometimes people feel like that's what evaluation is, but really we want to come in and make sure that any data we're collecting or any processes that we're doing are embedded into workflows so that they can be repeated over time. So considering the cost of the software, the cost of storing your data, and the cost in terms of staff time to create and update tools, in combination with thinking about how you will use the information in the future, will really help you think through and create tools that you can reuse and save time and maintain consistency so that you can look at the trends over time.
So next, we're going to take a few minutes and do a group activity and break folks out into smaller groups so you can work through this together. So if you attended the first couple of sessions, this part is going to look pretty familiar. We like to give you all a chance to talk amongst each other and apply the material in some small groups. So I'm going to ask you to talk about three things: resources, expertise, and experience. And I'll go ahead and put these in the chat here in just a moment. What kind of resources do you have available to do data collection and analysis? Is there budget or funding available? Do you have enough staff to do this work? How many people do you think you're going to need? What kind of time do you think this is going to take to complete? And how much time will staff need to devote on top of their other duties to doing this work? And then do you have the right tools or software to complete analysis, or are you going to have to acquire it? Secondly, I want you to think about, do you have the right staff expertise to do this, or do you need to pull in a partner? Could this be a place where the New England PTTC could help? Should you outsource some of the evaluation stuff because of all of the staff and time and expertise requirements? And then lastly, what kind of experience do you have conducting with an evaluation? So I would love for folks to be able to break out into groups and then really talk through these three things, and we'll rejoin. Welcome back. How did it go? What kind of resources do you have available to share your, to do this data collection? Do you have the right staff expertise? And what kind of evaluation experience do you have with conducting this program? So we'll have people post in the chat some of their thoughts from their groups. That would be great. And then we're going to revisit that PTTC 1 to 3 form as well. And this is going to be your homework assignment. So part of this is to finish today's activity if you didn't get a chance. So using that PTTC 1 to 3 form to think about your evaluation, what are 3 action steps you could take to start to further this evaluation design? So what are your next steps? So first, if you haven't finished today's activity, you can start there. Make a list of the resources that you need, data collection and analysis. Then you can really start to create a plan for how you're going to keep that data secure in collection and analysis and storage. And then lastly, you can start to think about sustainable plan for evaluation ongoing and what that might look like for your organization. So once again, at the bottom of that form, there's a portion that's going to be used to make notes about what's working and what's not, and then make notes about, is this a good place to ask the PTTC for help? Could they provide me for other resources or information? Could they help with some technical assistance? This is a great place to make notes for those. So this is our evaluation link for today's webinar. So you can use your QR code to scan that. We'll also put this link in the chat as well. And then of course we have our list of resources for things that we've cited today and all of the other information. And then please remember to join us for our last installment of this webinar series. In June, we're going to conclude the series with using evaluation to make data-driven decisions focused on telling your story and using that evaluation results and disseminating them to your stakeholders. And so with this foundation, we're really hoping, like I said, to really empower you all to go forth and make decisions about conducting and implementing your evaluation for substance use prevention programs. So thank you so much. And here's my contact information and Megan's contact information for any follow-up or questions or comments. Thank you so much for joining us today.
Thank you. Have a great rest of your day.